My name is Renée Quarterman. I'm a breast surgeon and owner of Delaware Breast Care in Wilmington, Delaware. I think the moment I decided to become a breast surgeon was when I was in practice as a general surgeon and realized that most of my patients were women with breast concerns and women with breast cancer specifically. And I found that I really enjoyed those interactions. I realized that I'm a talker and I'm an educator, and by and large, female patients tend to be very receptive to those skills. And so I really interacted with those patients very well. And I also found that for breast cancer in particular, there's so much hope in that field because breast cancer is very successfully treated in most cases. So it's very gratifying to walk women through the journey and then let them know that they actually can thrive and survive beyond breast cancer. So it's very rewarding in that way. Breast cancer is very complex. And so a woman who has been diagnosed and has to find a care team really needs to make sure that the people that she's relying on, first of all, know all of the details, but that they can explain them in ways that she personally feels comfortable with. Some women want a lot of information, some women want very little. So they have to make sure that their team is accommodating what their style is. They also, in my opinion, need to find people who are compassionate and who will treat them like an individual, like a client, as opposed to a patient or a number. So I decided to open my own practice, Delaware Breast Care, after years of being employed by hospital systems and realizing that I wasn't able to be fully myself. I grew up in Wilmington, and I wanted to always go back and serve that community. That's my home. And I also wanted to make sure that I could really focus on women of color specifically. And I found that working in a hospital system, there was always a barrier between me and my patients, between me and the community, and I really had to toe their party line and couldn't really be myself. So I knew that if I opened my own practice, I could really do everything my way, and I could give all of my patients the parts of me that the hospital otherwise wouldn't want me to share. I do hear a lot about Black women, Black business owners having trouble getting started and sustaining their businesses. And for me, I am grateful to say that I really didn't have those issues. I sought out Black bankers and I sought out Black advisors, and I sought out my fellow Black physicians who were already in private practice. And so I had a lot of support from the beginning in just getting into my business and getting established with all of the resources that I needed. Very fortunate in that way. Breast cancer is very successfully treated. It's been that way for quite a long time. We like to say that breast cancer for a lot of women may be like a chronic disease, like high blood pressure, but it's very rarely the death sentence that it used to be. And a lot of that is because of the research that's helped us learn about the specifics of breast cancer and different breast cancer types. And when we know different breast cancer types, we can then create specific therapies for those types. And those therapies have revolutionized our success with treating breast cancer. And I tell my patients that all the time. So knowing about the subtypes, even though that's fascinating and it's crucial, it's kind of old news. What I'm excited about are the forays into genomics and genetics and also artificial intelligence. So genetic testing, a lot of people have heard about genetic mutations. We know that Black women and women of color tend to be offered genetic testing less frequently than white women, but they have rates of mutations that are just as high as white women. And if we know they have mutations, we have therapies that we can offer them. We have screening programs that we can provide to keep them healthy and to increase their success for breast cancer treatment. So that's one area that I think is fascinating and that's growing. And another area is genomics. So genetic testing looks at the woman, genomics looks at the cancer. So we can actually look at the cancer cells and look at their tumor fingerprints. That translates into information that we can now use to personalize breast cancer care even more. And within genomics, what I'm finding particularly fascinating now is that some labs have found that Black women's breast cancers are different at the DNA level compared to other women's cancers. So when we notice that Black women might do worse than white women, stage for stage, one reason might be that their cancers really are different. They are not the same. So the more information we have and the more providers that know that, I believe the better the outcomes will be for Black women and women of color. And another thing that I think is fascinating is artificial intelligence. And we hear all about the dangers of AI and the benefits of AI, but we are now using it in screening mammography. There's one group that I work with in Delaware, and the experience from mammogram is the same for the woman. She has a human, a technician, positions her in the machine. A human, a radiologist reads her images, but alongside that, artificial intelligence is used to look over the images as well. So if AI finds something concerning that the radiologist thought was not concerning, another radiologist comes in and they look at everything together. And that is increasing breast cancer detection. So I definitely have my Black women who tend to have worse outcomes with breast cancer, and my women with dense breasts, and my women who are high risk, my women who have a history of breast cancer. I definitely encourage them to add artificial intelligence to their screening mammography. And I think that that's going to become standard of care, just like 3D mammograms have pretty much become standard of care. So it's a very exciting time to be taking care of breast cancer patients. So my message for the attendees of the MQ event would be, as a patient, as a human being, make sure that the people that you seek out for healthcare see you and listen to you and take you seriously. I have had women come to my office with breast masses who were told for years that it was quote unquote nothing. And I took the time to sample these masses, and they were cancers, and they were neglected cancers because people just didn't listen. And I will say, and we do know in medicine, that there are racists. There are people who are biased against us, even if they don't think they are. Medical education is biased in many ways against Black people and women of color. We lived it, we trained it. And so you can't expect that every doctor and every nurse sees you the same. And you can't expect that we are all going to take you as seriously, that we're all going to offer you the same treatments and diagnostic tests. So make sure that you can trust the person that you're sitting in front of. Make sure that you feel like they're listening to you. And if you don't get a satisfactory answer or you don't trust their recommendations, definitely take the time to look around and find someone else. I'm Dr. Renée Quarterman of Delaware Breast Care, and I'm fighting breast cancer for my community.